I am scared for my friends. I am scared for my neighbors.
Make no mistake, gender affirming care is medically necessary.
Within weeks of President Trump signing an executive order, major central Pennsylvania hospitals ended gender-affirming procedures for patients under 19 years old.
Why would anybody pre-comply with an executive order that almost mirrors the same policies that are being adjudicated here at the Supreme Court?
On that list, UPMC, WellSpan, Penn Medicine, and Penn State Health, all complying with the directive from the federal government to end gender-affirming care for people under 19 years old. Penn State Health adding they will continue to provide psychosocial care to adolescents and young adults 10 to 24 years old.
It really is frustrating that these places feel such fear that they're taking these actions before they absolutely must.
We have been getting calls of a surgery getting canceled because it's an 18-year-old.
Jessica Purdy and Parker Webb are executive partners at Lancaster County Chooses Love and say the hospital's decisions puts trans youth at risk.
Our organization has been working with the contacts that we have in each of them to understand what the actual policy changes are, why they're making this decision now, and to advocate for them to not do these things to our community.
A survey by the CDC found more than 300,000 young people from 13 to 17 years old identify as transgender. In Pennsylvania, it's about 10,000 young people.
Gender is a way we can express ourselves.
Before President Trump's executive order for a young person to medically transition, it required informed consent from both the patient and their guardians, a thorough evaluation and assessments by doctors and mental health professionals.
You all stand up.
There are under 18-year-old trans kids who very often get denied medical care because their parents don't agree with them receiving gender-affirming care.
For those that are just entering puberty, hormone blockers are the primary medical care that you would get that is trans-affirming.
Puberty blockers pause the production of sex hormones. For people assigned male at birth, puberty-pausing medications delay the growth of facial and body hair, deepening of the voice, skeletal changes, and genital growth. And in people assigned female at birth, the medications pause breast development, redistribution of body fat, pubic hair growth, and delays menstruation.
And that is the desired outcome. That is what really we want for our trans youth, is for them to be able to have that time to make sure that this is what they want, and then begin the puberty that they need to have to affirm their gender.
Both Jessica and Parker transitioned when they were adults and wish they had felt safe to explore their identity.
And so really having the ability to see people like myself would have been life-saving. It would have changed my life. I don't know where I would have been if I had had the chance to transition young.